I started my career in the pediatric intensive care unit, and there was a patient that I took care of for almost a year who had a very serious injury that left them without oxygen to their brain. The parents of this child felt that they didn't want to continue the therapies, and the clinicians wouldn't allow them to do that. And that case in particular, even though I didn't have a word for it at the time, I was really experiencing what we now know to be moral distress. And so I continued my education and got my doctorate. Then I've been co-chair of the Johns Hopkins Hospital Ethics Committee since 1999. Most recently, I've really focused on the concept of moral resilience, which is the ability to preserve or restore integrity in response to some kind of adversity. Nurses who are practicing today are confronted with myriad ethical challenges. They're trying to figure out informed consent. How do we provide good end-of-life care? How do we provide the care for people who don't have insurance? So we have been developing resources and doing training programs and trying to give them the skills and tools that they need to be able to confront these inevitable ethical challenges. We found really significant increases in nurses' ethical confidence and competence. We saw increases in their mindfulness and their resilience. And then we also saw decreases in depression, emotional exhaustion, and their intent to leave. One of the really exciting aspects of working at Hopkins is the legacy of pioneers like Isabel Hampton Robb. Isabel Hampton Robb was the first superintendent of nurses at the Johns Hopkins Hospital, and she was the principal of the training school for nurses from 1889 to 1894. She was an advocate for professionalizing and standardizing nursing practice, and she also was really a trailblazer in the area of nursing ethics. She wrote the very first nursing ethics textbook in the United States in 1900. And that book was really the foundation for what became our code of ethics for nurses. She identified how important it was for nurses to care for their own well-being. She was concerned about how nurses might overwork in terms of their duty and how that could be exploited in a system that didn't really value their contributions. Well, those are similar themes that have motivated my work to focus on moral resilience, to be able to say to nurses, your well-being and your integrity is a scarce resource, and we have to invest in it so that you are able to be a whole person, but also so that you can serve. And I can tell you from being with hundreds of nurses over these years, it's fascinating to me how we often begin in this closed, discouraged space. And over the course of these programs, we see nurses start to get some of that glow and that fire back about, why am I a nurse? And they feel capable because we've given them skills to meet those challenges.